It is truly one product with so many different possibilities.
Today, it's all about Sculptra. Now, there has been so much buzz about this biostimulating treatment that boosts your collagen, tightens and firms the skin. I've come up to Liverpool to see Dr. MJ Rowland-Warman. This is her clinic here, Smileworks, and she's going to tell me all about the treatment, and she's also going to do the treatment on me, which will be great because I haven't had Sculptra for about 20 years, and I can't wait to see what it can do for me. MJ, how is Sculptra different from other injectables?
Sculptra is not a filler, it is a biostimulator. It works very naturally to boost collagen and elastin within the skin and make the skin thicker and plumper and improve the outward appearance, the radiance of the skin.
How is it doing this?
When we age, 3 things happen. I call it the 3 Ds of aging. They are descent, degradation and deflation.
Sounds terrible, isn't it?
It's awful, isn't it? So descent means everything flops.
Yeah.
Deflation means we lose volume in our faces. And degradation is the surface of the skin gets less good as we get on in time.
Okay.
Sculptra is able to comprehensively address all those 3 Ds. And it does that by improving the thickness of the skin, by improving collagen and elastin. It does so by restoring volume gently, tackling deflation. And it also improves laxity in the skin by tightening the skin and improving the appearance of jowls and the jawline contour.
And is there a particular ingredient in it which is making this happen?
Sculptra's active ingredient is polylactic acid, or PLLA. And PLLA works by gently stimulating collagen production in the skin over a period of time of weeks and months. So it's not an instant result, but a much more long-lasting result and a more long-lasting collagen stimulation, which comes to the fore weeks and months after it's been placed.
Okay, so you get a tightening, you get a smoothing, and you get a bit of volume. How do we explain the volume that you get?
It's not instant. So with conventional HA fillers, we get an instant volumization, we get that instant gratification. And Sculptra works very differently. It stimulates the fibroblasts in the skin to produce collagen and produce thickness. So the volume that we achieve is much more subtle, much more gentle.
What are the sort of things that people can expect to see after a Sculptra treatment?
So after Sculptra, the actual science behind it is that collagen starts to form within a week or so. But as a patient, you will not notice anything until about a month down the line, when you will see quite significant improvements in the quality and the radiance of your skin. And that result will then continue to improve over the course of weeks and months and last for a staggering 2 years plus.
So it's a slow growing result, not a quick fix.
Very much so.
So who makes a good patient for Sculptra? What can it do for people?
There are a whole range of treatment indications that can be confidently addressed with Sculptra. And patients of a wide range of ages can be treated. So it's suitable for people in their 30s, right up to 40s, 50s, 60s. It can be customizable for every patient. So it truly is a product that has so many different possibilities.
Now, the skin laxity is a fascinating one because I've seen all these pictures on social of people picking up a chunk of their cheeks and stretching it right out.
Yes.
And then showing how a few months later they can't get such a stretch. So what's happening there?
Sculptra is I call it a dermal thickening agent. It makes the dermis thicker by stimulating the fibroblasts to produce more collagen. So skin becomes more bouncy. So when you pull the skin initially, it feels lax, it feels baggy, it feels like it doesn't have any substance to it because you've done a bit of aging. And after your Sculptra treatment, what you'll find is you pinch the skin and it feels a lot bouncier, firmer, and you physically cannot pull it quite as far.
Okay.
And the effect on jaw lines. I call it the threatening jowl. So when we're not quite into surgery yet, but we have
but
a
it's
jawline
threatening to descend.
Yeah,
okay.
it's threatening to not be what you want it to be.
Yeah.
Those cases are ones that can be restored with Sculptra beautifully and resharpen that jawline contour and really just tighten the jawline and improve that sagging of the lower face especially. And the lower face is one of the hardest parts of our face to treat.
The way you explain it, the thickening, that explains how you're not just getting a result in one patch, but you get this whole tightening over the face, which is what helps from the jawline upwards.
Indeed, you can use Sculptra over a huge area of the face. It gives you the most bang for your buck out of any vial of treatment that I know in aesthetics. And when we talk about skin tightening, jawline tightening and laxity, it's not the sort of pull up at the side, it's not a lift per se, it is a tightening and a firming of the skin quality. And that's really what restores youth. So we can treat Sculptra going from the temple. With Sculptra we can treat this phenomenal area and get a really good improvement in the skin quality over a very large area. We have a little bit of, if you have a little look in the mirror, we've got a little bit of volume loss around this area.
Yes. Yeah.
But what we do want to do is, smile for me, we do want to improve these little lines here.
Yes.
Okay, so what we can do is treat from a point at around about here into this cheek area. And we want to treat underneath here to straighten this jawline and blend the jowl into one continuous line so that we don't have this notch underneath the jaw. So we can access under here and treat into the posterior jawline and straighten this contour. And that's really where Sculptra wins, is this tightening of the jawline. We can also treat from this point down into the sides of the face and get a global improvement of this whole area, and potentially treat a little bit up here to just sharpen that angle of the jawline.
Lovely.
Sculptra into the subcutaneous plane, we can place a little bit around here. And where I absolutely love Sculptra is to place it back here into the hairline. So right the way back here to stop the forward and downward descent that we see with aging. 1, 2, 3, 3 separate entry points, and that's all we need.
Okay.
Alrighty, so you can see the cannula in that top layer, in your subcutaneous layer, nice and close to the surface of the skin. Nothing flashing nearby. Bob's your uncle.
What are the flashy bits?
Flashy bits are vessels. We don't want to go there. We don't want vessels. And it just nicely glides in. How's the comfort?
Comfort is fine. I can barely
A little bit
feel
bumpy.
it. Sometimes
a bit bumpy, but... Sculptra is a very painless procedure. It is
good.
It is injected by cannula. It's a nice treatment, especially for patients who are treatment naive. And in those patient cohorts, what we tend to see is people are reticent to have filler because they've seen all of the things on social media, all the scare stories, yet they want a comprehensive rejuvenation result. And they're also scared maybe of pain, of discomfort. So Sculptra for those patients is ideal because it addresses so many aging concerns. It is comfortable, it does a great job, and the risk of it is very, very low indeed. So it for me as an injector, it ticks all the boxes.
Okay. So are you getting a bunch of patients who haven't had any treatment who are suddenly stepping up for something like Sculptra?
Yes, I am. I'm getting a lot of patients who are sort of, my age, in their 40s, 50s, 60s, who, thanks to the media and social media, They know about aesthetic treatments now, and they feel that their time is right.
Okay.
But they don't want this dramatic improvement. They don't want this dramatic change in their appearance. Sure. They are scared of that look, as it were.
Because we all know what bad work looks like now, don't we?
Bad work is work you can see. So they're coming for consultations, and they just want a nice, natural, understated result that is going to do them justice, that is going to make them not look younger, but better, more well. The phrase is always, I just want to look good for my age.
Yeah. And how many treatments does it take? Does that rather depend on how your skin quality is, how old you are?
Yeah, it very much depends on what your expectations are, what your concerns are, and how old you are.
Okay.
So those three things, really. There is a guideline with Sculptra where we generally say the number of vials is how many decades you have lived.
Okay.
So as you get older, and as you have more aging concerns, you will potentially need more vials, and that is usually phased over a course of treatment. So it's a very gradual improvement, and it's a very gradual treatment that we do over a number of months until we get the result that we are happy with.
Okay, and so the patient can feel quite in control if they can see the improvement coming along gradually as well, I guess. And you do a lot of really detailed pictures beforehand, so you're able to show that change. I think that's really important, isn't it?
Pictures are so important for any aesthetic treatments. Good pictures before Sculptra treatment that you then review periodically with the patient are worth their weight in gold. But also they make the patients so pleased as to the choices that they've made and the investment that they've made.
Yes.
But particularly with Sculptra, it's more, yes, it is how you look, but it's a lot to do with how you feel. Because the skin quality improvement, how soft, how smooth, how radiant the skin is and feels, that is really what patient feedback is in an overwhelming amount of cases where patients come back and say, do you know what? I've had one session and already my skin feels amazing, and people ask me what cream I've been using. Obviously they never credit the injector.
So with radiance, how is it working on radiance? Because that's a really important factor.
The skin becomes smoother and the pore size becomes less.
Okay.
And there are actually also studies that show that pigmentation decreases. So your skin quality becomes better over the course of your Sculptra treatment.
Can you see this? There's a slight smoothing and filling and tightening from the volume.
Especially around this area where the aim was really to improve the posterior gel and that notch behind the jowl. That's really where we can see a good improvement. When you smile and you
got into those whiskers.
Yeah, we got into the whiskers. This is what we're similar to what we're aiming for. You're all a little bit swollen at this moment in time, but this is a similar result to what we're aiming for.
You'll get as it grows,
tightening and smoothing of the skin.
Sculptra's been around a long time, hasn't it?
Sculptra has actually just celebrated its 25th year on the market.
25 years, wow.
It has a very long track record of safety and scientific studies behind it. It has over 50 different publications just by Galderma alone, and the world over has hundreds, if not thousands, of publications associated with it. It's been used for both cosmetic and medical applications. So we have a wealth of knowledge about Sculptra, and over the time it's been on the market, about how we use it and now how best to use it to get the most comprehensive, but also the safest results.
Okay, and the formula's been updated over the years, hasn't it? Or at least the reconstitution of it.
Yes.
Yeah.
So historically, I know there has been some bad press. People have been scared of some of the complications, including nodule formation. And that was a big deal 10 plus years ago. Since then, the product has been updated and the formulation, so how we mix it together, has been updated so that we get the best possible results with the lowest amount of complications. As a practitioner, the rate of nodule formation is very, very, very low indeed. And I think if we want to cite some of the scientific publications, it's 0.004%. Okay. So we're talking 1 in 250. Yeah. And that is usually down to inadequate injection technique and poor aftercare. As a practitioner who very frequently treats complications, I have a huge complications practice, I can honestly say that the number of complications from Sculptra that I see and treat, and also the number of complications that Galderma refer to me to advise on, it's tumbleweed. It's
hardly any.
Very low, hardly any.
Wow.
I think the key is proper placement in the right layer, immediately underneath the dermis, so the skin, to stimulate fibroblasts and get you those good results. But also aftercare. After Sculptra, we have to do a lot of self-care. Yes. We have to do a lot of massaging. We call it 5-5-5. Yeah. So you have to massage the product 5 times a day for 5 minutes for 5 days, which for my patients is actually quite a nice thing because they get to massage the face and they get to really experience sort of a little bit of wellness in those 5 days post-procedure. And it helps the product settle in all the right layers and distribute the product in all the right areas, and that prevents nodule formation.
You said how you might be puffy for a day or so afterwards. What's the downtime like apart from that?
So there really is no downtime to Sculptra treatment. My patients resume their normal life the same day, the day after.
Tiny bruises from the cannula?
Yeah, I mean, you're breaching the continuity of the skin and there is always the risk of bruising. Sure. Obviously, we try and reduce that as much as possible, but sometimes people bruise and those can generally be covered up in the days after treatment. Other than that, we don't really see any downtime at all. Patients resume their normal lives and get on with their massaging, and that's pretty much it. It's very uncomplicated. And personally, as an injector, it's the treatment that I am quite happy to have. I use it a lot on my patients and the results are amazing. Yeah.
For your own face, what are the differences that you've seen with Sculptra?
It's going back to the 3 Ds of aging.
Okay.
As we go into our 40s.
Come on, there's no descent or degradation or anything in your face. It looks absolutely perfect.
Because Sculptra works.
Okay.
So I noticed textural irregularities. Okay. And those were really to do with the smoothness and how makeup and how, you know, that all was sitting on the skin. And since the Sculptra treatment, I've noticed a vast improvement in the smoothness of the skin. I've noticed that my little threatening jowl that I had has almost completely disappeared. And I want the subtle, the natural volume replacement.
And how does Sculptra work in combination with other treatments?
Sculptra can be combined with a whole host of different treatments, whether HA fillers for a targeted application of volume to parts of the face. It can be combined with things like skin boosters to give a plumpness and a glow to the skin. We can use it with energy-based devices like lasers to further increase collagen production. We can use it with a whole host of different treatments to maximize that collagen-producing effect that we will get on the skin. So in terms of, you know, how do we use Sculptra, who do we use Sculptra on, it is truly one product with so many different possibilities.
So here's my face immediately after my first Sculptra treatment, looking lovely, smooth and that bit fuller. And this will go down over the next 3 days, won't it? And I'll keep massaging. And then I'm going to come back in a few months' time and we are going to assess really properly what has gone on, what the changes are, what we can see in the way of improvement. So thank you very much.
Looking forward to it.